NBC4 News at 7.
Good evening, everyone. I'm Colleen Williams. Nearly 3 years ago, our lives changed because of COVID. From the federal to the local level, government agencies worked to tackle the public health emergency. Today, President Biden informed Congress that he will end the national emergency addressing COVID May 11th. Now, if you're like most of us, you're wondering, what does that mean? Well, the move would formally restructure the federal response to COVID, treating it as an endemic instead of a pandemic, meaning COVID will still spread, but at a more normal rate. It also means federal relief money will dwindle, and the federal government will not oversee the development of COVID vaccines. That also means the cost of COVID vaccines expected to skyrocket once the government stops buying them. Pfizer said it could charge as much as $130 a dose. And people with private insurance will have some out-of-pocket costs as well for things like tests and vaccines and treatments. If you don't have insurance, you will have to pay those expenses yourself. Critics say the president's move would create chaos and uncertainty throughout the healthcare system. Joining us live right now is Dr. Suman Radhakrishna, Director of Infectious Disease with Dignity Health California. Doctor, welcome back. Thanks for joining us once again.
Thank you for having me.
As someone who's on the front lines, is the healthcare system prepared for this so soon?
The healthcare system is prepared, but the question is, if we get a barrage of patients like we did during the pandemic, then it doesn't matter how much preparedness you have, it's going to fall through the cracks. So the best thing for us to do when the numbers are low and there is a lull is to go get vaccinated, continue taking the precautions. That way we'll be better off.
What do the numbers look like out there right now? What are you seeing on a day-to-day basis?
In all our hospitals across Dignity Health, we are seeing numbers coming down. The number of people seeking care for COVID symptoms has gone down since the Omicron variants, because these seem to cause more of an upper respiratory infection rather than a lower respiratory infection. We are still finding cases because we are testing everybody who's getting admitted. So we are finding mildly symptomatic to asymptomatic patients still.
You mentioned going out to get the COVID vaccine. Does it concern you that these vaccines could be that expensive and maybe out of reach for some people?
Yes, that is bothersome. And I'm hoping that policymakers will find a way out of this and make it more affordable and more available to everybody.
The other issue is we've watched COVID variants mutate over the years. It's 3 years now. Is COVID here to stay in some shape or form?
That's the way it is appearing right now. And we are hoping that it doesn't mutate back to the more virulent and the more stronger, more deadly strains. And it continues to die away the way it is now.
Doctor, before you go, in your estimation, are we at endemic stage rather than pandemic?
Yes, we are at endemic stage with blips. We will be seeing more cases, and when we see more cases, we may be asked to mask up and reduce our exposure to other people, but it is here to stay for now.
All right, doctor. Thank you so much, as always, for your expertise and your time tonight. We appreciate it.
Thank you for having me.
All right.